Welcome. I'm Greg Morrow, Program Director of the Conference Board's Employee Healthcare Conference, and I'd like to welcome you to our next session, What's the Impact of Employee Wellbeing and Health as we Return to Work? And now it's my pleasure to welcome our speakers. Renee Petrie is Chief Product Officer at Aduro, and Dr. Michael Todd is Vice President of Business Development at Bon Secours Mercy Health. Renee, Dr. Todd, welcome.
Thank you, Greg. Thanks, everyone, and thank you for joining our session today. I appreciate your support and interest in the conversation today about the challenges facing employers as we are now months long into the COVID-19 pandemic. And in most areas of the country, we're emerging from the lockdown, and more companies are facing some really important decisions about as they start to bring their employees into the workplace. So I think this conversation today is very relevant and timely, and it will center on both the physical and psychological safety and well-being of employees in a tremendous time of uncertainty. Before we jump into the conversation, we'll dive in a little bit more to introductions. So for those of you who may not be familiar with Aduro, we are a well-being company, and we work with organizations who believe that ultimately the performance of their employees and their company as a whole is deeply rooted in individual well-being. And our mission at Aduro is to help our clients unlock the potential of their employees and maximize their individual well-being and human performance. To introduce myself, my name is Renee Petrie, and I am the Chief Product Officer for Aduro. I lead our product development, which includes the technology that powers our well-being solutions. And I also lead our content and media lab division, which develops our digital and coaching programs that we offer to our clients today. I'm joined today by my friend and colleague, Dr. Michael Todd from Bon Secours Mercy Health. Welcome to our session today, Dr. Todd, and I'd love for you to just take a few minutes to introduce yourself and tell the audience a little bit about Bon Secours Mercy Health.
Good afternoon if you're in the eastern side of the country, and good morning, Renee. Thank you for having me, and hello, and thank you for attending today's session. Before I even begin on my bio, I'd like to just pause for a second. I work at a health system that has 60,000 plus employees. Most of them are healthcare providers, and I just want to pause and acknowledge that workforce who is putting themselves, their lives, their families' lives at risk by going into their place of work. So if you could just take a second and in your own way, acknowledge the work that they're doing. And there are some terrible hotspots occurring right now, and we all know where they are. So just really think about what they're doing today. I'm Michael Todd. I'm the Vice President of Business Development for Bon Secours Mercy Health. I'm a family doc by training. I worked in corporate medicine for a while and came back to Bon Secours Mercy Health based in Cincinnati, Ohio. And my whole day job is all about engaging external markets and delivering some healthcare solutions to employers across our footprint. We're a portfolio company. So I'm a medical director for a number of our different internal initiatives, and I'll just reference some beyond our associate health plan and our well-being program, and great partner in Aduro. We have a company called Conduit Health Partners that is a nurse access line and a transfer center capability. And then we have Harness Health Partners. Harness Health Partners is our employer-facing brand. I'm the medical director of both of those. So my day job is simply to build in new relationships across our footprint to drive commercial utilization of our network of services. So again, thanks so much for having me today, and I hope I can provide some content that's of value to your companies.
So thank you for that, Dr. Todd. Really grateful to have you here today, and obviously very grateful as well for all of the care and services that the Bon Secours Mercy Health clinical team is providing. Just to kick off the conversation, I think thinking about the clinical side of your workforce, healthcare has certainly been on the front line during this pandemic. And I'm sure the audience would appreciate just hearing a little bit about your experience at Bon Secours Mercy Health as you've navigated one of the most challenging times we faced in our work history, and particularly, one of an incredibly challenging period of time for the healthcare industry in general.
So happy to, Renee. The interesting thing is we're a large employer and we are a provider as well. So the vast majority of our 60,000 plus employees are working in our acute care sites, our hospital sites, or our ambulatory sites. And then we have our home office and a number of different administrative buildings. Those are our shared services, whether it's HR, IT, you name the functional unit. So our experience has really been very interesting. It's almost bifurcated. First of all, our providers are drawn to their professions to serve. So never before have we had the opportunity to serve our communities across our 4 states, and actually in Ireland now, like we have during the pandemic. So right away, we started building for capacity within, and everyone knows about ICU capacity, ICU bed capacity, as well as our ventilator capacity. We have several different states that we're in. I'll reference them: Ohio, Kentucky, Virginia, and South Carolina. Different markets across that footprint. Large markets, large metropolitan areas like Cincinnati as an example, and smaller markets. And I'll use Greenville, South Carolina as a relatively small market. But the singular focus was to maintain our capacity within our acute care sites, as well as deliver primary care across the footprint of our system. So from a provider perspective, we were really focused on just serving the pandemic, as well as the acute care needs that were unrelated to COVID. So you can imagine there's some testing processes that we went through. The non-clinical site, now that was interesting. We shut down immediately, probably mid-March, and went fully remote. And we don't plan to bring those remote workers back anytime soon. So that includes my job. So typically I sit in Cincinnati. Now I'm in northern Michigan working remotely with my 2 sons who are also working remotely. So we've had to think about the strategies for our providers and also for non-administrative, our administrative sites to stand up and keep operational our acute care sites. Any questions about that, Renee? I don't want to dive too much into the depth of testing at the moment, though.
No, I think that's a great overview, just the challenges that you're facing, both on the clinical side and the administrative side of your business. I think it's a lot to manage, and maybe a nice kind of segue into the topic of navigating the COVID-19 crisis. I know that over the last 3 months, Aduro has certainly been called on to be more agile and innovative than ever, as we've really strive to provide our clients with the resources that they need to navigate COVID-19. And, it's certainly very remarkable how this pandemic has impacted individuals and companies and the economy overall. When we started, responding back to this crisis, back in, late March and early April, we had a previous version of the slide that you see in front of you that actually looked quite a bit different. We initially projected that it would be, kind of like an earthquake, where we would see an initial, peak of COVID-19 infections, and then we kind of see those kind of after tremors, lower levels as employers started to bring their employees back to work. And then we thought, looking beyond that, we would see sort of this period of reinvention as businesses really thought about, how to adjust to a new normal. And I know you've seen this slide before, Dr. Todd, as we've talked about it, and you'll notice that what we once saw as a, peak and follow-on tremors has now evolved into a current state where we see actually a second peak in COVID-19 cases. So first of all, can you just take a couple of minutes and talk with us a little bit about what we're seeing with the COVID-19 pandemic today and what you think that might look like moving forward.
Well, I'll be cautious when I talk about this because every state, every locale is a little bit different. And you're right, that graph has changed dramatically. And I'm not sure it'll look the same in 2 months, to be honest with you. I can tell you internally, we monitor our peaks. We measure them as a company as peak census, the amount of patients in the hospital, and a number of different markets, of course. And so our peak census, that's the census, the number of COVID patients that are currently in the hospital, as well as the non-COVID patients in the hospital. That actually happened yesterday from a system perspective. We only have one of our sites, Cincinnati, as a matter of fact, that has a peak that's projected to occur in early July, so not yet a week away. So I'm anxious, to be honest, as a provider, that we're going to continue to see this flattening of the curve, which is fantastic. That means capacity within our health and all of our health systems across our country. But I think we'll see these little hotspots, if you will, and there's some big hotspots, unfortunately, right now, occur throughout the summer. And this is where the health departments, the health systems will begin to collaborate even more effectively than they are currently right now. They'll be able to do, because of the capacity, increasing capacity for testing, we'll be able to diagnose, contain, and isolate, and slowly, I believe that those peaks will get less and less and less. And my hope is that we, as a country, are responsible citizens, and I hope in the fall we don't have another resurgence. And I think maybe this current hotspot, and I'll use Florida and Texas and California, Arizona right now, is putting a little bit of fear in everybody, and recommitting everyone to appropriate social distancing and the measures, the personal hygiene measures that everyone needs to take to really prevent any major resurgence in the fall.
Yeah. I do think it perhaps is serving as an important warning and reminder to take the situation seriously. I think another interesting concept that this slide touches on is, that last box there, the need for reinvention. One of the people that I like to follow in sort of the business and tech world is Professor Scott Galloway. He's a professor at NYU's Stern School of Business. And, he's recently suggested that COVID-19 may really act as an accelerator for business change. And so when it comes to reinvention, how has COVID-19 changed the way Bon Secours Mercy Health does business today, and how you provide care to your patients?
So I'll answer that two parts. First thing I want to comment on, and I'm no business futurist by any means, but that future state, I think the audience should know that these same tactics that we're employing for keeping the work site safe to get the workforce back can be applied to the annual flu epidemic. And I think that's if you're all HR managers out there, or whoever the audience really is, I think it's important to know that the annual influenza epidemic has an impact on productivity in the workplace. And I think we could use these same tactics to really, in the future, help us keep our work site most productive. So the second, my second answer to that is, we've seen such a tremendous amount of engagement of the community as well as our providers on what I call virtual health. So virtual health is inclusive of telephone, as well as electronic visits or e-visits, as well as true video visits. Tremendous engagement, and don't quote me on these numbers, but we went from less than 50 before the pandemic year to date in 2020 to over 400,000 video visits, not electronic visits, not telephone calls, but since the pandemic started. So not only has our patients, our populations that we manage are embracing it, they love the consumer-centric nature of it all, but the coolest thing for me is that our providers have been, really embraced it, and probably took 4 years of work and compressed it into about 6 weeks to really stand up through video visits. And, I think it's here to stay. Payers are paying for it now. They may not have paid for it in the past. So that has certainly made it much easier for populations to engage with their providers, not just Bon Secours Mercy Health, but providers across the country.
Yeah, that's a pretty remarkable change in virtual care in a very short period of time. So that's quite amazing. One of the things that comes to mind for me when I look at this graph is the challenges that employees were even facing pre-COVID. So specifically for Aduro, we were very focused on some key statistics about how employees were doing, and what we saw really were employees that were overwhelmed and disconnected and disengaged. Pre-COVID, according to ADAA, 40% of American workers reported feelings of stress and anxiety. And the CDC reported that, 40% of people in the U.S. are disconnected and lack companionship or meaningful relationships. I just read over the weekend another study that reported that 3 out of 4 individuals describe themselves as somewhat or very lonely. And then Gallup, of course, tells us that only about 32% of employees really feel engaged at work. And again, I think, Bon Secours Mercy Health is in a unique position as an employer. You touched on the fact that your clinical workforce has been on the front lines and from day one, really responding under massive uncertainty. And then you've had a sizable portion of your workforce that's non-essential, that, like Aduro, has moved to working, 100% from home. So, let me ask you, what do you think the impact will be on the employees who were already struggling with feelings of overwhelm and disconnection and disengagement from the situation we're in today?
So again, I'll answer it from a provider perspective and all the different providers. And I'm talking about the MAs all the way up to neurosurgeons, all of the different providers that care for the frontline patients that we see in our acute care sites. I think there was a call to action. I think there was this, all of us went into healthcare to serve people. Bon Secours Mercy Health is a faith-based organization, and we really believe in our mission of serving the poor and the underserved. And so I think there was, it was in the beginning phases, I feel like our clinical workforce felt that they had an opportunity to really live their mission. So I thought that's neat. Now, there's something called compassion fatigue, and that's ongoing and with providers, and it's been going on for a long time because of the changes in healthcare. There's a lot of pressure on different providers. So I think that helped to a degree with that compassion fatigue. But that adrenaline that occurred in the very beginning of the pandemic, I think, is worn off. And I think our clinical workforce is at risk for substance abuse, all sorts of mental health issues. And our HR team within Bon Secours Mercy Health has doubled down on the messaging out around mental health services that are offered up that may not have been utilized in the past. And I know from EAP data, internal EAP data, it is being utilized effectively. And I'm excited about that. But then you look at our non-clinical workforce that was forced to go remote. I'm one of them. And it was a challenge to be productive. We all know that every day blurs now. Every day is either a Friday or a Monday, and we've heard these jokes too much. And it was very challenging to put guardrails around work and life outside of work. So again, our HR team recognized that and put out appropriate messaging on how to manage your workforce, you as a remote employee, how to be most productive, how to create those barriers and boundaries so that you can refresh and be ready for that next day. So I think, again, all of us are at risk, clinical, non-clinical. If you had a mental health disorder prior to the pandemic, likely had an exacerbation. If you were teetering on the edge of a mental health disorder, we all have anxiety right now, and you may have been pushed into having a mental health disorder. And those who didn't have a mental health disorder or teetering certainly do now, because we all have heightened anxiety, heightened fear, and so we're all at risk. And so if I could implore any of you out there in the audience to really work with your HR teams to message out very transparently that there are services available. I think it's time to double down on that messaging, if not even rebooting or refreshing what you're offering up.
Yeah, I couldn't agree anymore. And I know this is a topic we'll dive into a little bit more as we move on. I guess one thing I want to acknowledge is, certainly attending a conference today in our new normal can be challenging as well. So I think this is a great point to just break it up a little bit and bring our audience into the conversation with a quick poll. So we are interested in hearing from you and understanding where you personally sit today in terms of your readiness to return to work. So we have a few questions for you. The first question is, we'd like to ask you about your personal readiness in returning to work. So if you could just take a moment to tell us if first of all, if you'll be working from home and not returning to work, or if today you're concerned or scared and not at all ready to return to work, or if you could get on board of the idea of returning to work with more information, or if you're ready to come into work today. So I'll pause and just give a few minutes for the audience to answer. And we'll go ahead and close the poll in just a few seconds. So in 5, 4, 3, 2, 1. So, what we can see here now is some of the results from the poll. And what I'm seeing here is that actually more than half of our audience is going to continue to work and will not be going to continue to work from home and will not be returning to work. And the vast majority overall are not ready to come into work today. I see only 4%. Interestingly, we asked this same set of questions to our workforce at Aduro about a month ago now, and at that time we saw about 25% of our population was ready to return to work, and the other 75% were in some stage of unreadiness. The results here are actually much lower today. Dr. Todd, what do you make of these results when you see them?
Well, that third one, I could get on board with a little bit more information. That's what we're addressing right now for our non-clinical or administrative workforce. We're really focused on workplace safety and securing the work site, and really messaging out that when we do return to work, when you do come in employee, how we use the bathrooms, how we use the kitchen, the cafe, the elevators, on and on. And this is encouraging to me because people are concerned about that. And I think the more we can allay their fears that, hey, we worked through this process, and after 2 or 3 days of coming to work, you're going to get more and more comfortable with those little baby steps that you make. And no longer will you be carrying a bottle of Clorox or bleach with you under your arm to your workstation. But not a shock to me at all.
Yeah. So, let's dive a little bit deeper and see what's behind that. So for the next question for our audience, it really gets to, what is the biggest concern for you personally? And the choices for that question are, is it your health and physical safety? Is it psychological safety? So in other words, your comfort, sharing what your needs individually are and asking questions related to returning to work. Is it maybe your employer screening and testing requirements, or none of the above? So again, we'll just give a moment for the audience to respond.
And Renee, I can comment on that too. My biggest concern is because of the COVID 19 pounds I've gained. I'm worried most that my pants will fit when I go back into the workplace.
I can relate to the COVID-19 pounds as well, so I hear you there. Okay, we'll go ahead and close this poll in 5, 4, 3, 2, 1, and let's go ahead and look at the results here. So, overwhelmingly, we can see that the audience is really concerned with the health and physical safety. And so I think that's a really nice segue to go ahead and jump into, the heart of the discussion today. One of the things that, the challenges that we've been facing at Aduro is guiding our clients as they think about their return to work. And in response to that, we've aligned on a work readiness model that provides a framework for thinking about how to support your employees as you embark on return to work. And we're going to go ahead and use this framework to guide the rest of our conversation today. But before we jump into that conversation, let me just take a couple of minutes to walk through this. When I think about where we've been for the last 90 to 120 days and actually where we are today, taking a look at that poll that we just did, we're kind of in the first stage, which is not ready. And for employers of non-essential workers like Aduro, this has necessitated a massive change in the way we work, with 100% of our workforce now working from home. And, like many other employers, Aduro has had to grapple as a company with the questions about, how do we maintain productivity? How do we maintain culture while also supporting individual employees who, in many cases, are now balancing a lot of additional responsibilities, parenting, homeschooling, or maybe even as a lifeline to older generations who are forced to isolate. Stage 2, kind of working up from the bottom, is safe. And so here for essential workers, this has been a concern for the past several months. And now for most employers, here the key question is, how do I ensure the physical safety of my employees by setting an effective protocol for return to work that will minimize risk to my workforce through effective screenings, including both on-site and remote screening, and then follow-on testing as needed. Stage 3 is well. So for employers, this means really refocusing efforts to create a sense of well-being and psychological safety by providing the appropriate support and tracking of both physical and emotional well-being. And then stage 4 is engaged. And so here, we look at a renewed focus on re-engaging the workforce and focusing on the important role that mindset and resilience can play in helping employees bounce back from the uncertainty and the stress of the pandemic, and really refocusing on individual purpose and relationships and a sense of work community. And then stage 5 at the top is what we call Kinetic Performance. And this is really unlocking the full potential of your workforce and achieving a sustainable approach that focuses both on growth and well-being of your employees. So, Dr. Todd, I know we've talked about this model before. Can you just share, with the audience how this work readiness model resonates with your experience at Bon Secours Mercy Health?
Yeah, so it's such a great pyramid because we're at both ends of the spectrum. Big dispersed workforce across 4 states, clinical, non-clinical. So when I reflect, as you were saying this, going through it, when I reflect on our workforce, that Kinetic Performance, those were our frontline providers. They didn't stop working. But there was a subset that did. So if you think about those ER nurses, those ER doctors, the ICU nurses, ICU doctors, respiratory therapists, they were full on from the very beginning and have been full on. If you go down the level below, engaged, this is what we're doing right now for those non-emergent clinical employees. So think about some of our ambulatory sites. So primary care docs who had been refocused and pivoted to video visits and electronic visits. We're trying to re-engage them right now by securing their, think of your primary care doc that you work with, his or her site. to make sure that that site is safe. So those patients with diabetes, those patients with emphysema, those chronic conditions can be managed, and they were neglected. And it's time for me to put a plug in for childhood immunizations. We missed that. We neglected that during the pandemic. So we recognize that as a provider employer, and we want to make sure that we have re-engage those sites so we can tackle those chronic conditions and preventative services. Then we have the non-clinical sites, and that's way at the foundation of this triangle, that we're not ready. We don't know. We're a provider-led organization, so we lean on evidence, and we don't know that much about the virus. We think we do, and you'll read a lot, and you'll hear a lot about what people think, but we also recognize, and I'm sure we've all seen this, is that the science changes every day. So we don't feel like we need to, at this point, force our non-clinical employees back to the workforce until we understand the virus a little bit better, transmission rates, what really works. And so it's interesting to use this model to look at our headcount across our footprint.
Mm-hmm. Yeah. What really stands out to me in listening to you kind of talk through that is that it's important for organizations to remember that their entire workforce is not going to be at one stage in the model. I mean, you've just laid out perfectly how Bon Secours Mercy Health really sits at several different places in this model, just depending on what segment of your workforce you're talking about.
And Renee, I'd add to that too. I think what's interesting about that is, I'll use HR as an example. Individuals vary within a functional unit. So you may have Michael Todd, who has no interest in coming back to work, and you may have Renee Petrie, who is, taking the baby steps to really understand how to be safe and is comfortable because maybe she has shopped or gone to restaurants, and Michael Todd has locked himself into his house and doesn't want to even step out of his home for fear of getting transmission from wherever. So individuals within one functional unit could vary in their own personal readiness.
Yep, I couldn't agree anymore. So we've talked quite a bit, I think, about this first stage, which is not ready. And again, where, a lot of people in our audience today are sitting. Let's go ahead and start stepping through this. And so when we think about, safety, to your point, I think like individual characteristics, behaviors, factors such as age and health status can really play a significant role in an individual's readiness to return to work. And these are some of the things that we should be thinking about when we move into stage 2, which is safe. And so I think employers are faced with a number of considerations when they're thinking about bringing employees back to work. This includes, an effective protocol for monitoring employees for symptoms and environmental safety protocols for employees once they're on site. And then for employees who may be experiencing symptoms, I think ready access to testing also plays a key role. And so, Dr. Todd, I thought, COVID testing is another area where, as employers, we find a lot of information that we need to sort through. So I was hoping maybe you could just take a moment to tell us a little bit about the different types of COVID-19 tests that are available today and what we should be thinking about as employers.
No, I'm glad to talk about it. I think this is a good reference slide for the audience to pick up after the conference. So there are 3 main test sites, or test types, excuse me. You've got the PCR test, you have the antibody test, and then also the antigen test. And if I say one thing today, I want you to hear is the PCR test is the test that we're relying on and should rely on. Antibody tests and antigen tests are not validated, and we're working through that. And eventually, we'll land on some testing that is accurate, is sensitive, and specific, that we can make appropriate clinical decisions on. But right now, it's PCR testing. So PCR testing is testing for the presence or the absence of the virus. Across the country, capacity varies, even within a state, the testing capacity for PCR testing. varies dramatically. So that's one thing. And you'll hear about the turnaround time for tests. So I've seen turnaround times for PCR testing within a day, and I've also seen 96 hours, and then some even further in the beginning of the pandemic. Now I'm going to switch to antibody test. Antibody test, or serology tests, they test for the presence or absence of IgM and IgG, and it really depends on which test, and there are now hundreds of them out there. But the idea is to look for immunity in someone. And again, the sensitivity of these tests is not good, so there are false negatives out there, which is the last thing you want to lean on as an employer, is a bunch of false negatives when people actually have the virus and they come into the work site. So again, more to come on that. I'm hopeful that we'll have some tests that we can lean on. And the antigen test is more of think of a test in an office, in an ambulatory or a primary care office, like a flu test. Even pregnancy test is based on this kind of antigen identification. So it's not there yet. Big labs are working on it, and the turnaround time and the utility of this test would be great when it is validated and successful. But again, if I can hammer on this, you in the audience only lean on PCR testing at present. It's the only test that we believe clinically we should be making decisions on return to work.
Okay, that's very helpful. I think another question that people may have or may be curious about is, if an individual thinks that they may have been exposed to COVID-19 or knows that they were exposed to somebody else with COVID-19, is there an optimal window for testing? Should they go right away? Should they wait? What kind of guidance is out there right now in terms of timing for testing?
Thank you for handling that controversial issue. The reality is, you probably shouldn't. If you were exposed, you shouldn't get it the next day. Whether it's 3 to 5 days, you want to make sure that if you're tested the next day, you may not have the volume of virus in your bloodstream to meet the threshold for a positive test. So there should be
false negative.
Say that again.
So if you go too early, you might experience a false negative test. Okay.
That's right. And again, we're still learning about this, and we're hearing about people that are asymptomatic carriers and asymptomatic transmission. It's very confusing and it's scary. I get that. Mm-hmm. But if you do develop a protocol and you work with, I'll use Harness Health Partners, our employer solutions company. We only use PCR testing, and if I can again encourage you, come up with a protocol and stick to that protocol. Work with your local provider, work with a company like Harness Health Partners that deal with this day in and day out, and get a nice vendor or vendor partner that you can lean on to help you navigate the testing process.
Thank you. That's really helpful. Again, a lot of things for employers to really, really balance, and this information is really helpful. So let's go ahead and move on to stage 3. So as a employee well-being company, this is something that we've been keenly focused on over the last 3 to 4 months as our workforce has gone 100% remote. We've been working really hard to ensure that we're responding to the needs of our own employees, as well as the members that we serve on behalf of our clients. And earlier I mentioned, the level of overwhelm and anxiety and disconnection that people were feeling pre-COVID. And, Dr. Todd, as you sort of mentioned there, the COVID-19 has really exacerbated some of these issues. One of the things that's kind of unique about Aduro is that we take a very human-centered approach to well-being that combines expert coaching with digital technology to support people on their well-being and human performance journey. And one of the interesting things that we've noted in analysis of our coaching calls is that regardless of the goal or intent for, an initial coaching session, whether it's an individual who wants to schedule time with our coaches to talk about nutrition or smoking cessation or financial well-being, or something else, mental health issues such as stress and anxiety and overwhelm were cited in about a third of the calls. Our behavioral health coaches, specialize in providing support on mental health issues. And I think that it's important to recognize that we are in a period of trauma right now, as we've touched on a little bit during this conversation. The way we work, the way we learn and get education, the way we seek care, Dr. Todd, as you mentioned, and interact with each other has just been flipped on end over the last couple of months. And, to a large degree, we're really uncertain how long this will continue. So, coming from the front lines, Dr. Todd, and thinking about a workforce that deals with trauma each and every day, are there any advice? Is there any advice that you can provide to other providers, as other employers, as they're supporting their workforce during this period of time?
That's a great question. So to answer that first question, just straight on, I think it's all about leadership and leadership communication and the transparency of communication to the workforce. I've seen that in our company. I think our leadership team has done a wonderful job of sharing transparently what's going on in our markets. We see detailed analytics of everyone sees detailed analytics of hotspots that are occurring, and so if I could land on one thing, it would be the transparency of leadership communication. I think would be critical. As I speak to this slide, trauma. I think you think of trauma from a provider perspective. I think of a motor vehicle accident and an ER, but I think there's psychological trauma that's occurring to all of us right now. I mean, our control is gone. We've lost control of our life, and that's a traumatic event. And I think it's much like grief. They're a process that people will go through in different stages of grief. So I encourage everyone in the audience to think about this as a traumatic event and treat it more like a grief reaction, because we have lost control. I also like those last two boxes, length of the crisis. If you're an HR manager, prepare for the duration. This is not going to go away magically in the next 2 months. We're going to be dealing with this for a while. And I think preparing your teams, those you manage, for the length of the crisis, I think is so important right now. And building, using maybe the benefits that you have right now or the resources that your teams have right now to build resilience, talk about it openly. Politics aside, we're seeing what's happening in the workforce, and this is not going to go away overnight. And then the last box is substance abuse. And I'll use alcohol as an example. Yes, there is an opiate epidemic ongoing, and Ohio is the epicenter of that almost. But alcohol is a big issue, and people have lost the soft control that around alcohol and its use. And you think about it, if I go have a beer at a bar, it's the bartender or the waiter pours that. Here at home, I don't have anybody monitoring that. And so just one example that I think all of us have to be mindful of that. And I could quote a number of different, and you guys in the audience have probably seen the amount of liquor sales, and it's skyrocketed. So please develop programming or relaunch programming that you may have to support substance abuse and alcohol in particular.
So many important issues that you just touched on there. I think we could probably devote an entire conversation to this topic alone. I can't say enough how important it is to make sure that your employees have access to the right resources. And also, to your point, Dr. Todd, those resources can come in many different shapes and forms. In addition to, executive leadership, I think that effective people leaders who can coach employees straight through these challenging times are more important than ever. So thinking about how you invest in developing those skills for your people leaders. I think access to coaching, including human coaching and digital resources, are both really important. I know one of the things that we did at Aduro last quarter is that we rolled out a number of 6-week long mental health programs that our employees and the employees that we serve could participate in remotely. Those were actually our most popular programs in April and May. So there's obviously a real demand for these resources. And even though those resources were digital programs, they showed a positive impact on what we call human flourishing measures. So people reporting a higher degree of overall happiness and purpose in life after taking part in the program, as well as a significant decrease in overall stress that was reported, pre and post completion of those programs.
Renee, can I ask you that just to I want to rehear that. So face-to-face coaching with a live person is one thing, and then you have the digital programming that's available. They're equivalent in its outcome or close to equivalent?
They're generally very equivalent in the outcome. The data that I just shared there was from analysis just of our digital programs. So significant impact in all of these different areas. Again, individual flourishing, as well as a reduction in stress. And so, it does show that you can provide these resources effectively at scale to your remote workforce.
I think that's a value. And again, I'm going to speak to the audience and in particular talk about Bon Secours Mercy Health. Mercy Health has a mental health institute. A lot of health systems have mental health institutes that provide behavioral health coaching and behavioral health services. What you said it made me think about the virtual capability of it all. It can't be face-to-face right now. So the virtual capability is critical. And yes, Bon Secours Mercy Health has it. A number of other health systems have it. So again, if your workforce has that access to that, encourage it.
Mm-hmm. Yeah. That was the sole reason for my transition from academia out into the for-profit sort of tech world. Is we developed so many interventions in the university setting that we could deliver really effectively in kind of face-to-face in community settings, and the ability to leverage technology to reach more people more effectively is so important, and again, now more important than ever, I think. So when we put all of this together, as an employer, when you're thinking about bringing your employees back to work, I think it's important to have effective solutions for remotely monitoring signs and symptoms for COVID-19 at home, and then the ability to connect that remote monitoring data to on-site temperature checks and screening services for employers who want or need that extra level of security. And then, of course, coupling that with behavioral health resources and coaching that can support your employees, and promoting all of the other resources that you may have available to your employees through your EAP programs and other HR resources. So I guess one of the things that I'm curious about as we've been talking about the trends that we're seeing in the news as employers are faced with, decisions around reopening during this recent peak of infections, really comes down to, the ability for employers to access virtual care effectively. And so again, Dr. Todd, I'd just love to ask you, coming from your background and your experience, what would an ideal remote monitoring and testing protocol look like for employers? What should they be thinking about?
So there's no one right way, but what I can tell you what Bon Secours Mercy Health is doing. We do have an internal capability called Conduit Health Partners, that it's a nurse navigation line, and we have a dedicated pod there that's focused 100% on COVID. And we share this not only as to our associate health plan, but also external partners. So again, our external partners and our HR team has messaged out to these populations of employees that if you have any symptoms, don't hesitate to call, and our engagement is great. And then we have dedicated nurses that work through a protocol that are help with the go, no go, don't go to work, go to work, or route them to an appropriate testing center or the primary care site, Again, every market's a little bit different. Some have flu clinics, drive-through kind of testing clinics. So it would depend on the partner. Our partner has line of sight and optics into what's happening in every market. So we get them to the right site of care at the lowest cost. We also offer up virtual care with our primary care providers and specialty providers. So a lot of this for us is, I wouldn't say easy, but we've worked through this. We've just done warp speed right now. And then, it's kind of interesting from a testing perspective, as we reactivated and opened up what we're calling elective surgeries that most people are aware of right now. We tested all the patients and we tested all of our providers. And we did that, I think, for about 2 weeks. And we stopped testing our providers because our incident rate was so low, it was less than 1%. But we continue to test our patients that are coming in for elective surgeries. So we're a unique employer, I get it. And we have access to testing, so we can do that kind of thing. But ultimately, whoever the vendor is that you work with, a local provider, just develop a protocol and when you're going to test. I encourage symptomatic testing only right now, and then a protocol to return them after they've either recovered or convalesced from an acute infection or they test negative. And it's, again, sticking to that protocol and not pivoting so much and changing with the wind that with the hot spot that flares up in your community.
Perfect. Great. Thank you for sharing that insight. So kind of continuing to move through the model, I think it's really important to, at stage 4, to look at re-engaging employees and helping them focus on work again. Dr. Todd made, the point earlier that not everybody kind of moves through these sequentially, or your whole population. So you may have individuals who are at this stage already. And so stage 4 really is, our engaged stage of the work readiness model. And for me, one of the challenges that, I face at Aduro is, thinking about how to build a technology platform that enables us as a company to be really responsive to the needs of our customers. And so, that's presented a number of challenges just in this last year. In 2020, as I referenced earlier, it meant extending our typical well-being solutions or our human performance offering to incorporate a comprehensive mental health solution that's fully integrated into that well-being solution. We think it makes a lot of sense for well-being to be blended for mental health to be blended into well-being so that we can take a much more proactive approach there. And then in response to COVID-19, we were able to extend our platform to also meet employers' needs for on-site screening, so temp screening services, as well as, providing the capabilities right in the platform as well for remote monitoring of those COVID symptoms so that employees, know if they're safe to return back to work. And as a human performance company, we also know that ultimately a person's ability to perform at their best is deeply rooted in their well-being. And so that brings us to stage 5, which is kinetic performance. And here the goal really is to unlock the full potential of your workforce. And it's necessary for employers to think about how do they sustain well-being and performance of their employees and the overall organization. And so, Dr. Todd, we've had the honor and pleasure of working with Bon Secours Mercy Health for, 5 or more years now. And together we've really experienced the positive impact that an effective well-being solution can have for your associates. So your program at Bon Secours Mercy Health is called the Be Well program. And what stands out to you when you think about the Be Well program at Bon Secours Mercy Health?
I could talk for about an hour. Thanks, Renee, about what stands out. But personally, what stands out is well-being at my fingertips. And I look at the slide that you're sharing right now on my cell phone. I've got that right there. And, I'm on a journey to improve sleep personally because sleep over the last 3 months and the years before that haven't been great. So one of the journeys on within our Be Well program is right at my fingertips. So I enjoyed that. You also offer up health coaching as part of our benefit to our associates. I've taken advantage of that. And that's different than a mental health counselor or a psychologist that you may see in the community that's part of your EAP program. These are life coaches of sorts, different degree. I'm trying to respond to a Q&A question that came in a little bit. But bottom line is just the engagement of it. And we've seen it within our workforce that it's produced a call to action for our associates.
Thank you for responding to Q&A as you go through. That's perfect, working it into your answers. Such a multitasker. Amazing. So at the beginning of the session, we kicked off by talking about personal readiness and return to work. And we want to end the session today with some practical guidelines on how to assess your organization's risk tolerance as you work to bring your employees back into the workplace. And so I want to close with a couple of resources. First of all, I think just based on the conversation today, it's really clear that there is no blanket solution for employers as you're evaluating your return to work strategy and your policies. And so I encourage you to, think about and to find tools that can help you assess where you stand as a company with all of the circumstances that uniquely impact your organization. So, for example, it may be useful to think about where your organization follows on its own risk tolerance scale, which can balance the needs for, a return to organizational normalcy with the needs for employee safety. And where your organization sits on this scale can really range from kind of an ultra aggressive to an ultra conservative stance. And by knowing where you fall on this continuum, I think it really will help you think through the administrative and environmental policies that are needed to promote overall well-being and human performance. And so we'd like to invite you to dig a little bit deeper into the risk tolerance scale by visiting Aduro's virtual booth, where you can find these resources and complete your own version of the risk tolerance assessment. And then we've also assembled a number of resources that will be helpful to you as employers. That's also available in the download of the slides today and at our virtual booth. And at this point, we have just a couple of minutes left for questions. And so, Dr. Todd, have you had a chance to take a look at the questions?
I think we're almost out of time, Renee, and I think probably just handing it off to Greg at this stage would be perfect.
Thank you. Yes, we are. Great information. We are over time, but the good news is if anyone has any questions, a survey is going to pop up. We'd really appreciate your feedback, and then an exhibit redirect is going to pop up. So you can go into Aduro's live exhibit space. You can click that link. It'll take you into the space. You can talk to their executives, ask any questions that we might not have gotten to, and download information and learn more about what Aduro does.